point-of-care HIV tests, also known as rapid HIV tests, allow us to give someone a provisional HIV result in around 30 minutes. Rapid tests are based on the same technology as the initial screening tests undertaken in a laboratory. Normally a small drop of blood is taken from the end of the finger and is then transferred onto a testing device. One or more solutions, depending on the brand of test, are then added to this in order to start a reaction which renders a readable result, usually a line or a dot. Again, the exact indicator depends on the brand of the test being used. Currently, Terence Higgins Trust use one of 3 brands of HIV test. The first one, shown here on the far left of your screen, is able to test for 2 different things indicative of HIV infection. One of these is called P24 antigen, and usually only present in early HIV infection. This test also tests for antibodies to the HIV virus. It is important to point out at this point that when we undertake a standard HIV test, we are not testing directly for the virus itself. What we are testing for is antibodies to the HIV virus. In other words, we are testing for your body's reaction to the virus. After infection with the HIV virus, it can take up to 8 weeks for antibodies to be present in sufficient quantity for us to detect, though most people will show detectable antibodies between 3 and 4 weeks. Rarely it can take up to 12 weeks. The period of time from infection to the appearing of detectable levels of antibodies is called the window period. That is why if someone was recently exposed to HIV, it is possible that they will appear HIV negative on an antibody test when tested before the 6-week mark, when in fact they are positive, because it takes this period of time for antibodies to appear. That is why we test for P24 as well. P24 is present before antibodies have formed, typically dropping below detectable quantities after 3 to 4 weeks as the antibody level begins to rise. The test in the middle of your screen is called an Insta-HIV test and only takes 60 seconds to give a result. It is as accurate as the first brand of test we outlined, but is only able to detect antibodies. Thus, we use it to detect established infection, that is infection after the 6-week mark. The third kind of test on the far right-hand side of your screen is called an ORAL-Quick. This test is an oral HIV test. It uses antibodies present in saliva to detect HIV infection. It is as accurate at detecting antibodies to the virus as the other 2 kinds of test we use. Again, it is only suitable to detect established HIV infection. We commonly use this test for people who do not like to have their blood taken or are nervous of needles. If a positive result, termed reactive, is obtained from one of these tests, then the person will be referred to a hospital where they will undergo confirmatory lab testing. Rapid HIV testing has revolutionized the testing process and has enabled us to offer testing in diverse settings, including within our own clinics and in outreach settings. Prior to the advent of rapid HIV testing, it was necessary for people to endure weeks of anxiety before receiving their results. Additionally, it allows us to undertake a high volume of tests in a short space of time and thus detect the maximum number of people potentially infected as possible, reducing transmission in the process as people become aware of their infection much more quickly. This has positive health effects for those testing positive as well, because it means they are able to access treatment much more quickly.